Hey everybody, Dr. Adam Mathews with Mathews Counseling, and every month we try to offer resources around different issues and different topics that we feel would be helpful to our clients and our community. And May is Mental Health Awareness Month. So we are talking about different things to raise awareness around mental health. And one of our fabulous interns, Allegra, has written a wonderful blog post around that issue. Is going to talk to us a little bit about this. And it's around the issue of self-diagnosis, which Allegra, like one of the biggest things that people do now is really go on the internet first, look up a bunch of symptoms look up their symptoms that they're experiencing and try to learn more about what's going on. And there's a lot of pros and cons to that, right? So like talk just a little bit about kind of the starting place there of kind of what's happened over the last 10 to 20 years where people are getting a lot of their information online. And there's some really good stuff with it, and there's some really things to just kind of be aware of as we go through that. So, as it relates to mental health diagnosing, just talk to me a little bit about kind of your experience with that, and kind of the how folks are really using that to start to understand what they're experiencing.
Yeah. So I think that, like you said, especially in the last 10 or 20 years or so, there's been a real boom in mental health
Yeah,
and the attention that we're paying to our mental health. And people are curious.
yeah,
And the stigma has also rolled back a little bit. And so people are a little less uncomfortable with the idea of having any diagnosis, which used to be something that carried a lot of shame and was very difficult for people to deal with. And thank goodness we
yeah,
have moved to a time where that has significantly decreased.
yeah,
So I think that's allowed for a little more curiosity, and that's led people to things like books or the internet or, like community groups online, like forums and
yeah,
things where they can exchange information about what they're experiencing and,
yeah,
talk to both experts and peers about what they're experiencing and see if any of those things are lining up
yeah.
in diagnostic criteria. And of course, that is the very first step to getting to your mental health journey is being
Yeah.
curious about how your brain works and what your mental health experience is.
Yeah, I think that's one of the huge pros is the idea of curiosity. Like because if we can adopt that idea that we're learning and that we're curious about what is happening to us, I think that is such a great starting spot because it's so much less stigmatizing than saying there's something wrong with me, but saying I'm curious about what is happening. I want to learn more and I want to kind of use the resources at my disposal to be able to learn more about that. I think that's such a healthy and great starting point for us. And I think that's where I hope stigma kind of continues to decrease around is that I can go, oh, I'm experiencing these things. Doesn't make sense to me off the top of my head. Let me like learn and be curious about that. And so talk to me more about some of the like, what are the things that we can really, the pros of doing our own research and doing our own digging with the resources that we have to really kind of learn. What are some of the things that are really beneficial about that from your standpoint?
I think people are being given permission to have their experiences. I
Yeah,
think that's the biggest thing that's happening through this, online and community outreach of mental health
yeah,
and connecting with each other is people are getting more comfortable with allowing themselves to experience the things they are experiencing. And that is, of course, the first step toward understanding anything about, your behavior or your choices or your emotional state is accepting that that is what's happening instead of trying to deny what you're experiencing because you think you shouldn't be experiencing it. I think that is the number one pro as far as self-diagnosis goes. And I think, it's not all sunshine and roses either. Some
yeah,
people are unfortunately, for one reason or another, they do not have access at the
mm,
time for, mental health care from a professional or from an expert
yeah,
who is capable of helping them through those things in, the ideal way. And sometimes we have to hang on until we can get there. And I think that self-diagnosis is a big piece of, okay, I know what's going on, and I can just get through until I can get to a point where that care is accessible for me. And that
Yeah.
I think is the biggest, um, it's almost a crutch that is being used to
Yeah.
help people in that in between point,
Yeah.
which is so valuable.
Yeah, 100%. I think being able to have an idea about what's happening can really help us. It's very empowering a lot of times to really know what's going on and to be able to make sense of the experiences that we're having, the symptoms that we're experiencing. And I like what you're saying there, like getting us to that point of it being a help till we can get greater care in that. So tell me a little bit about how you conceptualize what's a good way for people to go about this, right? What are some the ways that they can do can it kind of look at their symptoms, explore in a way that's healthy and good as they're going about doing that.
So the first step is always going to be check your sources.
Yeah.
Never take advice from just anywhere. Never, take information as fact from just anywhere. Try to make sure that if you are searching for factual information, you are getting it from a reputable source, like
Yeah.
a mental health institution, a doctor, some other form of expert who has, accredited
Yeah. Who put resources out there?
expertise.
Yes, 100%. Yeah.
Right, exactly.
Yeah.
And as far as being selective, not everything is going to apply. Not everything should apply. And that doesn't necessarily mean that you are or are not within the criteria for a certain diagnosis. These things are very subjective. So, if you hear a video that says, oh, if you do this, 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 and this, then you have ADHD, take it with a grain of salt. It's
Yes.
possible that you do, but it's not a diagnosis.
Yeah.
So it's important to be safe when we're taking all of those many, many inputs into account.
Yeah, I think that's the biggest thing for me too. It's like you want to get it from credible sources, but at the same time, even if you are getting it from credible sources, I don't get locked into that being the 100% absolute thing that's happening. I think it's really helpful to say, okay, these are some things that I'm experiencing. It seems to fit this, but not getting locked into that because it could fit a lot of other different things as well. I think because also I know I do this too. Is like when I put in my symptoms, like I tend to gravitate toward the biggest and the most catastrophic diagnosis that I can find for myself that fits there. So it's really important to kind of pull that back and take it, like you said, with a grain of salt as well. So. What are some just we also need to be cautious, right? So when we're looking at that thing, how do we fit that into kind of like self-diagnosing into our overall course of treatment? Like what's the progression of things that we need to do from there once we've kind of done some digging and try and think we have a general idea of what's going on?
Yeah, at that point, I would say if it is accessible to you, you should be reaching out to some form of mental health professional, whoever you think is best to fit your particular mental health needs. So,
Mhm.
if, for instance, you believe that you may be struggling with some disordered eating, that would be an eating disorder specialist. Or if you struggle with, romantic relationships that are unhealthy, that would be, a relationship therapist or a couples counselor, someone who can help you specifically with what you are going through because you have now done the legwork to get a specific idea of what it is that you are working toward or what you want to work on. So that's a huge step as far as self diagnosis being valuable to both the person who is dealing with that and also their care team, because that means
Yeah.
that they're coming in with an idea of what it is they're struggling with, even if they don't have the clinical or medical terms for it. They
Yeah.
have a way to express what they are experiencing in a specific way that then allows us to take that information and say,
Yeah.
okay, well, from what you're telling me, it sounds like this would be the best course of action. And then your care team can get that level of information from you
So,
as well as from their general data bank of
yeah.
resources.
I think that's a great way to go about it. I always appreciate clients when they come in and say, I'm curious about this for myself. These are the symptoms I'm experiencing to the best of my knowledge, but I'm curious about that because oftentimes there are, like you said, there's a lot of different ways to fit symptoms together, and there's a lot of questions that you like that are helpful that your mental health professional or other professionals can help say, hey, like, yeah, let's think about that. But there's either an assessment for that, or there's other questions to ask, or there's qualifiers, some of which you may be familiar with, some of which you may not be. And so being able to kind of really confirm that, and again, being open, like that's why I like when clients say, I'm curious about this, because that allows us to take the right approach to it, and kind of explore that together and see what fits best. Because that's really what diagnosing is about, is seeing out what fits best here for you at this time, given the symptoms that you're experiencing, and can be really helpful to then kind of build out a good treatment plan going forward for you. Awesome. Okay. So I ask everybody, what's the one thing you want folks to take away from a conversation like the one we're having right now?
Balance, I would say.
Yeah,
The most important thing when you're talking about self-diagnosis is balance.
love
You
that.
want information, you want to know more about yourself. You also do not want to wander into the territory of being operating in absolutes. And
Yes.
so, that middle space is very important. Be curious, but leave room because there's always more to know.
I love that. I think that's the perfect attitude to have with that. When there's so much information at our fingertips, like I think one of the things is, especially when there are um there are lots of people that talk about a lot of issues. Like there's a really good thing where there's people with large platforms online that talk about things that need to be talked about, right? And are giving a voice to things that need to be discussed that are not often discussed in a public setting. The challenge with that is that, like when I hear about a new thing by somebody that I like, oftentimes I immediately go, "Oh, that's me," right? And follow that up. That's great, but then follow that up with further digging, with research, with accredited sources to make sure that that's there. And then that middle space can really help us kind of propel us forward in getting the help and getting the treatment that we need. So I think that is what you're articulating is such a helpful thing to be able and perspective to take. So thanks for talking about it. And if you do want to discuss kind of the learnings that you found, the things that you might be curious about, we have tons of therapists that can uh, help you dig further in and explore those things further to come up with the right diagnosis for you. So you can schedule an appointment with one of those therapists at mathewscounseling.net. You can learn more about our therapist at mathewscounseling.net/therapist. Where Allegra is one of those, our intern therapist that sees clients at a sliding scale fee. Our effort to try to make mental health care accessible to everyone. So, Allegra, thank you so much for taking the time to talk with us about this topic.
Thank you for having me.
All right, we'll see you next time, everybody. Bye bye.